So I just say that as a sort of as a lead-in to talk about impacts on small businesses, because there are so many things that are happening right now in Washington that have an adverse and detrimental impact on the ability of small businesses to create jobs. I have heard the President talk about, creating jobs. Number one priority ought to be creating jobs. We need to give incentive to small businesses to create jobs. I have heard my colleagues on the other side come down here day after day and talk about job creation and how important it is. And yet everything that is coming out of Washington, whether it's the form of heavy-handed regulations like this endangerment finding that's coming out of the EPA, whether it's in the form of a cap-and-trade proposal that's coming through the Congress right now, whether it's this massive expansion of the federal government, $2.5 trillion expansion of the federal government to create a new health care entitlement in this country, all these things, Madam President, are raising clouds over the small business sector of our economy, which creates about 70% of the jobs. And so we're essentially telling small businesses that, you may end up with these massive new energy taxes. You may end up with this employer mandate that's going to cost you up to $750 per employee if you don't offer the right kind of insurance. You're going to be faced with all these taxes that are going to be imposed on health insurers and prescription drugs and medical device manufacturers that are going to be passed on to you. And then we're saying, go out there and create jobs. In the light of all this policy uncertainty in Washington, all these proposals to tax and to spend and to borrow more money by their federal government. And so you can't blame small businesses for acting with a little bit of hesitancy when it comes to making major capital investments, when it comes to hiring new people. And those are the very things that we want small businesses to do. We want to encourage that type of behavior. We want to encourage that kind of investment. We want to encourage job creation. Unemployment, it's at 10%. We've lost 3.3 million jobs since the beginning of this year. Who's going to put people back to work? It's going to be the small businesses in our economy. In my state of South Dakota, as I said earlier, they're about 96% of the game when it comes to employment in South Dakota. And so here we are debating a health care reform bill, which in addition to spending $2.5 trillion to create this new health care entitlement, raises taxes on small business, cuts Medicare, and at the end of the day, according to all the experts, the Congressional Budget Office, the chief actuary at the Center for Medicare Services, which is the so-called referee in all this that tells us, what these things are going to cost and what the impacts are going to be, they've all said that premiums are going to stay the same or go up. The best a small business can hope for under this is the status quo. So I hear our colleagues on the other side coming down here day after day after day making statements about this is going to be good for small businesses, this is going to help small businesses deal with the high cost of health care. The problem, Madam President, with all their arguments is one thing. They are completely and utterly divorced from reality. You cannot look at this proposal, this health care reform proposal, and come away from it and say, this is a good thing for small businesses, when small businesses are saying this is going to drive up the cost of doing business, this is going to raise health care costs, and these taxes that you're going to hit us with is going to make it harder for us to create jobs. And so why do we proceed in the face and defy what all these small businesses are saying, what all the experts are saying, and what increasingly the American people are saying, and that is this is a really bad idea. Why don't you guys go back and reconsider this and start over again and do some things that actually will lower health care costs? That's what our small businesses are saying. And so we have people down here saying that this is good for small business. Well, what are small businesses saying? And large businesses, for that matter. NFIB represents small businesses all over the country, said this bill will not deliver the widely promised help to the small business community. They go on to say it will destroy job creation opportunities for employees, create a reality that is worse than the status quo for small business, is the wrong reform at the wrong time, and will increase health care costs and the cost of doing business. That's the National Federation of Independent Business, which, as I said, represents small businesses all over the country. Large businesses, the Chamber of Commerce has come out and expressed their disappointment with the Senate health care bill and has weighed in strong opposition against it. The National Association of Wholesaler Distributors, the Small Business Entrepreneurship Council, the Association of Builders and Contractors, the National Association of Manufacturers, Independent Electrical Contractors, International Franchise Association. The list goes on and on and on. And in fact, there's an organization called the Small Business Coalition for Affordable Health Care, and that's 50 organizations around the country who are members of that group, including many that have members in my state of South Dakota, not the least of which is the American Farm Bureau Federation, which represents farmers and ranchers who are small business people out there trying to make ends meet. They submitted a letter which said this: our small businesses and self-employed entrepreneurs have been clear about what they need and want: lower costs, more choices, and greater competition for private insurance. They go on to say, these reforms fall short of long-term meaningful relief for small business. Any potential savings from these reforms are more than outweighed by the new taxes, the new mandates, and expensive new government programs that are included in this bill. That, Madam President, is what the small businesses across the country are saying. Now, the reason they're saying that is because, as I mentioned earlier, not only are they hit with these taxes every year, there's a tax on health plans that will amount to $60 billion over 10 years, which will be passed on to small businesses. There is a new payroll tax, Medicare tax, which incidentally, for the first time ever, instead of going to Medicare, will actually be used to create a new entitlement program. That tax will hit about a third of small businesses across this country, we're told. They, as I said earlier, have the employer mandate, which is going to hit a whole lot. It's another $28 billion that's going to hit small businesses across this country. And so you have all these new taxes, and all of them heaped upon our small business sector. And so the small businesses are saying, okay, what do we get out of this? What's this going to do to affect our health care costs? Well, I want to show you what it is going to do to their health care costs. This, Madam President, represents what the Congressional Budget Office has said health care costs would do if this bill is enacted. The blue line represents there the cost, essentially, if you will, of doing nothing. In other words, the blue line represents what will happen if Congress does nothing. That is the year-over-year increases that we're already seeing. It sort of represents, if you want to call it, the status quo. Well, we've heard people come up from the other side and say, we've got to do better than the status quo. The President says that, the Vice President says that, our Democrat colleagues say that. You can't accept the status quo, and Republicans are attacked for being in favor of the status quo. Well, Madam President, the blue line represents the status quo. The blue line is what's going to happen year over year in terms of increases in health insurance premiums that small businesses and individuals in this country are going to be dealing with. And it doesn't matter where you get your insurance. In the employer small group market, in the employer large group market, in the individual market. Ironically, if you get in the individual market, your rates are going to be 10 to 13% higher. Madam President, could I ask unanimous consent to extend for another 5 minutes?
Without objection.
Madam President, it doesn't matter which market you get your insurance in, except, as I said earlier, if you're in the individual market, you're going to pay much higher insurance premiums than just the status quo, which is locking in double the rate of inflation increases in insurance premiums for the foreseeable future. But the red line, Madam President, represents the spending under the bill. This is what the Congressional Budget Office says will happen. You will see the cost curve bent up, not down. So you're going to have more money coming out of our economy to pay for health care in this country than you do today. That, Madam President, is what small businesses are reacting to and why they are coming out as strongly and adamantly opposed to this legislation as they are. It bends the cost curve up. It increases the cost of health care in this country rather than bending it down. And so, and we heard the same thing come out of the actuary of the Center for Medicare Services just last week. Again, the experts are saying, the referees, the people who don't have a political agenda in this debate are coming out and saying repeatedly, this is going to increase the cost of health care. This is going to drive health insurance premiums higher in this country. Now, the other point I want to make, because after I've shown you how health care costs are going to go up under this legislation, is the other amazing thing about it, and this is one of those phony accounting techniques or gimmicks that Washington uses, sort of same old business in Washington, same old Washington smoke and mirrors, ways of disguising what this thing really cost. In order to bring this thing in at about $1 trillion, which is what the Democrat majority wanted to do, they had to use a lot of budget gimmicks. And the senator from New Hampshire is here. He knows all about this because he's followed this very closely as the chairman of the Budget Committee for many years. But he can attest to the fact that one of the things that they did is they started the tax increases immediately. So on January 1st of this year, next year, which is now 18 short days away, all these businesses across the country are going to see their taxes go up in 18 days. But the amazing thing about it is many of the benefits don't start getting paid out for another 1,479 days. So they front load all the tax increases. So all these tax increases are going to get passed on immediately, and by 2013, every American family is going to be paying, starting next year, $600 a year up to the year 2013. So every American family is going to feel the brunt of these additional costs for taxes and the premium increases that will follow from those. But the amazing and remarkable thing about it is they actually structured a bill that would punish small businesses and people who are going to pay these taxes on January 1st of 2010, 18 days away, and don't start paying out the benefits under the bill for another 1,479 days. What does that do, Madam President? In the 10-year window that they use to measure what this thing's going to cost, it dramatically understates the cost of this legislation. And so what we're faced with is not a $1 trillion bill, but a $2.5 trillion bill when it's fully implemented, and when all these budgetary gimmicks and sort of phony accounting is actually taken into consideration. Madam President, this is a bad deal for small businesses. That's why all the small business organizations have come out opposed to it. And you cannot get up on the other side day after day and defy reality, and defy logic, and defy reason, and defy facts. And that's what those who are trying to push this huge government expansion and this huge takeover of health care in this country are trying to have people believe. They are just dead wrong. And I believe the American people are tuning into that, which is why increasingly in public opinion polls they are turning a thumbs down on this by majorities of over 60%. And I see the senator from New Hampshire is here. I'm happy to, I appreciate him indulging me for an extra few minutes, and would be happy to yield back the balance of my time. Thank you, Madam President.